directly with lawyers who provide ILA in some capacity, as well as some community members who can give us a perspective from their side. And so we ended up having consultations with 21 lawyers. That looked like a focus group with 6 ILA lawyers from the Schleifer Clinic, interviews with 5 ILA lawyers who are currently on the ministry roster list, and 10 other lawyers within, mostly in Toronto, but also outside, who practice ILA either through their own private practice, through a pro bono service, etc. So we really got a different view of ILA service throughout the province. Then what we ended up doing also was holding a focus group with hospital-affiliated professionals who were sexual assault nurses or administrators who could give us a perspective from their end about what survivors were looking for, what difficulties they might have had, or some strengths in engaging with the ILA process as it currently exists. And so I had a focus group with 7 individuals from across Ontario, and then a more focused interview with 2 Toronto-based for a total of 9 community members related to hospital-affiliated services. So as you can see, it was a very robust 30-person consultation over the last month or so. We've designed a survey that is a little bit broader that can go out to both lawyers and community organizations, community members working with sexual assault survivors, which we're hoping to conduct over summer so that we're able to take some of those findings early as the program launches and weave them into the trainings and some of the offerings. So those are the demographics of what we did in this consultation. So the strengths, we heard a lot of strengths about the current ILA ministry program. The number one thing I heard was that it exists. Just the mere fact that this program is existing in Ontario, it's a beacon for other provinces. A lot of other ILA programs were modeled off of this particular program. Also just symbolically, you know, not just that it exists and is helping people, but that it is showing that there is a stand being taken against sexual assault and sexual violence in Ontario. That the clients who can take part in this do not have to qualify for legal aid, which is usually the standard for a lot of programs with any kind of legal help. And everyone thought that that was something that was really impactful. And that ability to have those privileged conversations with a lawyer. So I heard a lot about the limitations that can occur with many other interactions in the criminal justice system for survivors in particular, in engaging with Crown and VWAP, et cetera. And so this was the one kind of precious place where people could have those privileged conversations and be able to, you know that what they were hearing was going to stay between them. In terms of the administrative process, I heard from both the affiliated professionals in Toronto and the lawyers that being able to access a bio list, being able to see the different practice areas, take the time to look up people, etc., having that choice, that agency was really important. Being able to address multiple legal issues so that while most thought that the criminal process was the most common avenue that they were engaging with, that there was still an ability to talk about civil law proceedings, talk about sexual harassment if it was within the context. And so, you know, it was a little bit broader than just limited to criminal, and there was an appreciation for that. And the ability to engage at different stages. So again, the fact that this is something that someone who was sexually assaulted 50 years ago could access services for, that they could do this before they give a statement, while the trial is ongoing, years later if there's a civil case. Just the fact that there were an ability to engage at different times was considered to be a real strength. In terms of limitations, what I found when speaking with, particularly with the hospital-affiliated professionals outside of Ontario, or sorry, outside of Toronto, if you want to move to the next slide, Viviana, was that nobody had actually heard of the 4-hour ILA ministry program. They had heard of other ILA programs, but when I directed them to the website and we looked at the form together, they actually were not familiar with it at all. And so that was, we really saw that outside of Toronto, there was a lack of knowledge about this program. Some did say that, they had such strong relationships with VWAP that they believe that they made that reference to VWAP and then VWAP knew about the program. And so survivors were still getting connected. But largely, we heard from lawyers as well that outside of Toronto and outside of certain sectors, there really just wasn't as much knowledge about this program, and they really wanted to see more promotion about it. We also, as I was going through the form, there was some feedback on how to make the application process more survivor centric, which we've taken note of, about not having to download the form and email it, having to provide an address before you talk to someone could put some people off. The language is high level, so just some considerations of how to maybe make the approach a little bit more survivor friendly. From the lawyers, we heard a lot about how there was a hope that the list could have been opened sooner or had like an ability to apply annually, and not be so Toronto centric, even though recognizing that is where a lot of the population is and there is a strong need. Anecdotally, some of the lawyers had indicated that survivors just weren't always able to connect or connect in a timely way with lawyers on the list. And there also is a limitation to sexual assault and not the spectrum of sexual violence. And there were some inquiries about whether there was time to revisit. This was the time to revisit the full spectrum of sexual violence under the program. One of the main themes that came out, next slide, Viviana, please, is the need to promote. So we heard from, and this was both from the hospital affiliated professionals and the lawyers, that more needs to be done to promote this program across the province. The number one thing I think we were hearing was that it would be amazing and wonderful if survivors could know about this program and speak to a lawyer before they give a police statement, and that they wanted to see the support and training of police to be able to refer those coming in to give a statement to this program first, if they so choose to engage with it. A lot of what was being done within this program is undoing some of the unnecessary disclosures that were being given in police statements. So that was one of the largest things we heard. Also wanting it to be just more internet searchable, a little bit more available in terms of, people that won't know the term ILA, can this program still come up in a Google search? And then obviously there's many other places that people had great ideas about promotion. So within hospitals and medical clinics, refugee and immigration centers, at universities, colleges, and high schools, the TTC in its different formats, rape crisis centers and DV homes, women's shelters. With VWAP, we heard hit or miss. Some programs really know and promote this program and others not so much. So how do we make this a little bit more uniform? Community organizations and drop-in centers, jails and immigration detention centers, and on reserves and in more northern, rural, and remote areas that are maybe not aware of this program. So just very briefly, for those of you who were interviewed, you know that I asked this question, and I got some really great, next slide, Viviana, really great answers from both the lawyers and from the hospital affiliated teams. So from the lawyers, we asked, what are the competencies, training, expertise that you would like to see ILA rosters have? What should they be able to bring forward if they are going to join this roster or to stay on this roster? And so overall, the number one thing I heard from nearly everybody was a trauma-informed approach. And within that, acting in anti-oppressive, anti-racist, and intersectional ways. Showing a demonstrated experience with working with sexual assault survivors, and preferably in multiple legal forums. So we heard a lot about how a lot of individuals are coming forward with complex issues that may engage different areas of law. And if there is, intersectional expertise, that's only going to benefit survivors. We heard a lot about how the list needs to be more diverse in many different ways, both with identity, in geography, and location across the province. Like we said, it's quite Toronto centric. Having more lawyers who speak multiple languages would help to serve many people, as Toronto especially has many new immigrants and non-status individuals. We heard, like I said, most felt that criminal law expertise was the number one most important aspect in terms of a particular legal area. And that involves, knowing the current state of the law and keeping up with changes in this area of law. Having run trials being a very, some thought it was a must, some thought it was not necessarily a must, but especially knowing the process in depth is something that's definitely going to be needed by survivors. We heard also, though, that there is in recent years been a growing need for more civil sexual assault law experts, especially with cases of defamation arising, and really just understanding that even though that might not appear like an issue, it might arise in the future. And so just helping survivors to know that these things might arise has become increasingly important. We also heard that there is a need for some family law expertise which was lacking on the roster, because there are some growing intersections with child protection issues, with gender-based violence, etc. And of course, immigration and refugee law. We heard about regulatory law becoming more and more prominent. If someone is part of a regulated profession, the unique issues that are arising there, and sexual harassment and labor and employment, more broadly, unionized workplaces. So again, that sounds like knowing everything, but that definitely shows us just how complicated these sexual assault issues can be. And then just very briefly, I just wanted to highlight on the next slide what the hospital affiliated professionals were saying. So a lot of the same was coming up. What I thought was really interesting and unique in the focus group and in the joint interview was that there was a lot of push for youth, which I wasn't hearing as much within the lawyer focus group. A lot of what I was hearing was that the individuals are coming forward with sexual assaults are vulnerable youth, including youth who have been human trafficked, youth who are growing up in the Crown Ward foster system, who are being sexually assaulted by those who are supposed to be protecting them. And so really just wanting people who understand youth, the neurobiology of youth, how they might react, what they're thinking, and then also the legal issues associated. So something that to keep in mind for sure. As well as regulatory proceedings, I heard a lot about sexual assault happening at hospitals committed by doctors and nurses. So that was particularly what they were seeing, but also in other regulated professions. A lot of immigration refugee issues, really wanting to see people who had expertise working within Indigenous communities and supporting the LGBTQ plus community, and also with the intersection of mental health and addictions. So it was a really robust, consultation with 30 people in different formats, and we're really looking forward to seeing what the survey results are. But take in mind that I really appreciate you sharing these findings with me and that we have taken them to heart and are going to implement them. So I will pass that back over to you, Deepa. Thanks so much.
Thank you so much, Ashley. And again, I want to thank everyone who has participated in these interviews. And I want to assure everyone who has not yet spoken to us or given us feedback, we will be coming to you. We have a survey design that will be going out and rolled out. And we will make sure that every feedback that we're receiving and which can be operationalized and that can impact the program in coming months, we will make sure that that happens. So moving on to operationalizing the ILA program at the clinic, we want to share with you some basic facts, some which hasn't changed. So the next slide talks about the program eligibility. So if Viviana can help me. Yes, thank you, Viviana. So the program is still going to be for survivors of sexual assault in Ontario and people will receive 4 hours of confidential independent legal advice. The program will be eligible for women, men, trans, and gender diverse people in Ontario. It will be available for people who are 16 years of age, who live in Toronto, and sexual assault has happened in Ontario. And live in Ontario. I said Toronto, I apologize. Sexual assault happened in Ontario and the people live in Ontario. This program does not include representation, and survivors can also access wraparound counseling services and support at the Schleifer Clinic. Along with this program, people will still be able to access ILA at the clinic. And the way that would work out is that all the clients who we feel would benefit from getting that wraparound intersectional support at the clinic and they need case management at the clinic, they will be referred to the clinic program. And folks who we know need expertise of roster lawyers will be getting benefit from the roster program. There might be a few clients here and there who might get benefited from both programs, but we will be making more concrete plan around that piece as we see what client experience is like. So some of the pieces we don't have black and white written down at this point because that would be based on client experiences and as we collect information from the client's own experiences and the evaluation of the program as we proceed. In terms of what is happening right now, if you go to the next slide, in terms of the transition, the clinic is going to be managing the program from April 1st, 2025. For a lot of you, the main difference is the workflow, that the workflow is now going to happen from the clinic. For clients' perspective, they will still be calling the same number, the 1-800 number that they had. So they might not know, if they haven't accessed the program, that their call is now getting picked up at the Schleifer Clinic, although the ministry's page and our page will say that very clearly. But for user experience, when a client is calling, for them, they're calling the same phone line. And they are using the clinic's contact form to connect with us. We will be overseeing recruitment of the lawyers and expansion of the roster list. So there has been a social media post that has been put out with a SurveyMonkey linked form for people to complete. These forms will be received here at the clinic with help of a project lawyer. We are going to be connecting with each lawyer who completes the form for an informational interview, and we will be bringing people on board. Bringing people on board would also mean a few things in coming weeks and months. We will be creating a community space for you, like an online community hub space for you, where you'll be able to have conversations with each other. You will be given resources on a regular basis, and there will be trainings done. All of these are our commitments, and that will happen. You are part of the pre-preview group today. So this is a pre-rollout. So this is not an official rollout group. This is a pre-rollout group. But we are letting you know because all these things are on our work plan and will happen in coming weeks. Key things to know, that as of April 1st, the updated hourly rate will be $158 per hour, in line with the Legal Aid Ontario's Tier 3 rates. And outstanding invoices dated April 31st, 2025 or earlier should still be sent to ministry, and it should be done ASAP if possible. Moving forward, your invoices will come to the clinic, and we have some slides which talk about which address, and we will send this information to you as well. You don't have to be taking notes right now. We will make sure that all of this also comes to you in your email, and it will be given to you again and again when vouchers are issued. But let's look at the workflow, and we will be pausing to let you ask us questions. So please bear with us for a few more slides as we give information. I think we're giving you a lot of information at a very fast speed. Me and Ashley speak really fast, I notice. But let's look at the workflow, which Paula will explain to us. Paula, over to you.
Good morning, everyone. So any client looking for assistance with a recent sexual assault or historical sexual assault, they can connect with the intake team in different ways. So they can email us, they can submit an online submission form in our website, they can call us, and they also can come to our walk-in day. And in the next slide, we'll provide you with all those contacts for the client. Once they are connected, the client is connected with an intake worker, we will do the same assessment that we do for every single client that comes through the clinic. So they will be asked some demographic information. They will be explained our limits to confidentiality. We will do a conflict check. We will do a risk assessment with the clients to make sure there's no risk of harm. And if there is, they will complete a safety planning with the client as well. And then they will move on to ask some relevant questions pertaining to the incident of sexual assault, but not only that incident. Like sometimes clients have additional areas of law that they need assistance with, so we'll ask about that, or any other needs that are not connected with legal. They may need housing, they may need counseling and other services. And then the intake worker will provide them with the appropriate resources that could be internally or externally. Once this process is completed, the intake worker will have a unique identifying number for the client, which will also be the ID voucher when we send it to the lawyers. And they will be provided with 3 names of lawyers that they should call to book an appointment. The exception to that is some of our clients have a language barrier. And so maybe the intake worker in those cases has to do that coordination of the appointments for the client. Once the client has the appointment booked with the lawyer, They will call us back and let us know the lawyer they are meeting and the details of the appointment. And at that time, the intake worker will create the voucher with that unique identification number that I mentioned earlier. But they will also create a summary of the legal issue and the client's needs, and they will send both the voucher and the summary to the lawyer and to the client. This voucher will be valid for 90 days. If the client does not use the voucher in the 90 days, they need to call us back. And this is just for billing tracking purposes. We will cancel that certificate and issue another one. Once the client meets with the lawyer for the ILA session, then the lawyer should send us the invoice, and we will provide you with that email address to the clinic within 90 days of meeting with the client. If the client wishes to request a second voucher of 2 hours, they will have to call intake again, and they can choose to meet with the lawyer they meet initially, or they may choose that they may want some other lawyers, and then at that point we will provide them with a new list of lawyers. And then again, the same process. Once the lawyer meets with the client for the ILA session, they will have to provide the invoice within 90 days of that ILA session. Also, for the appointments, if interpreters are needed, there's a second language barrier for the client. Those interpreters will be booked by intake for the appointments. Sometimes, although the voucher is for the 4 hours, but sometimes if we have a complex case and depending on the resources that we have, we may issue a third certificate, to the particular client for a lawyer. Clients can contact us, again, to access the program if they experience another different sexual assault and access the program all over again. Once this process is complete, within some time of the process being complete, then we'll have the intake workers doing a follow-up with the clients. We want some feedback on their experiences with the program. That could be from the time that they did the intake, the experience with the lawyer, the timelines that happened between each step. That's very important, and that's with that feedback that we can make also improvements or changes. Next slide. I'm gonna now go over the different emails and contact numbers. So they are different for clients and lawyers. So for the client to contact the clinic, they can email us at voucherintake@schleiferclinic.com. Or like I mentioned, fill out the online submission form in our website. They can call us at 1-855-226-3904, our main line at 416-323-9149. They can also choose to come to the clinic on our walk-in day. Our walk-in day is every Friday from 9:30 to 3:30. People can just walk in, but they can also call in advance and they can book one of the available spots. And that can be very helpful, especially if they need an interpreter. We can have that booked in advance and have both the interpreter and the client in person at the clinic. So if you remember, in the current process, the clients would need to fill out this online form prior to accessing or meeting with the intake worker. They do not need to do that anymore. And then when we provide the contact to the clients for the lawyers to book the appointments, will always be the preferred method of contact that is listed in the client's bios. For the lawyers, you may need to engage with the intake workers if it is questions pertaining to the client, pertaining to the summary that we provided, and that would be through our individual emails. So that would be either me, Wendy, or Martha. And when you want to send your invoices, you will have to send it to ILA Voucher@schleiferclinic.com. On the summary that we send you with the client's issues, we also going to send you the preferred method that they want to be contacted. Many of our clients are still living with the abusers. And so sometimes they have some restrictions in the times that we can call and the ways that they want to be contacted. So all of that would be provided to you. And I think that's it for my part.
Thank you, Paula. I think it's me again. I see a question from Sonia that will the rate will be plus HST. Sonia, I think let me come back to you because from the clinic's perspective, we are required that you include your HST on every invoice. But let me circle back with you on that. I want to make sure that I'm not saying anything out of the line for the ministry, and because at the end of the day, we have to reconcile the rate with the LAO rate. So we will confirm that in our follow-up communication. But it's a good question. Thank you for asking. In terms of the voucher and the timelines, the ILA voucher must be used within 90 days of being issued from the clinic. This voucher can only be used for 1 2-hour ILA session with the lawyer named on the form. We will be making sure that the client who is getting a voucher is followed up. So we will have our own system in place that we will actually be making sure that someone from the clinic follows up in 90 days and checks with them. If they haven't gotten to one of the 3 lawyers whose name we have given to them, and we will not basically let it be hanging and be in abyss where no one knows like what happened to that voucher. Every voucher will be followed upon. And therefore, in the same vein, we want all the vouchers to be sent within 90 days of the ILA session once it's complete. ILA sessions occurring in January to March must be sent prior to the end of March for the program's fiscal year end. But you will have assigned admin people, and the team will be supported by everyone in the room, including Marian, who could be giving you some clear instructions on how to manage your invoices when March 31st comes, because I know that a lot of us are under pressure when that time of the year comes. So we will work with you, and we will, if you need some extra days here and there, I'm not saying that, we will ask everyone to be sending them in the first week of April, but we can work with you and figure out how to support and making sure that everyone gets paid appropriately. In terms of the voucher, this is the picture of the voucher. This is what the voucher would look like moving forward for you. Moving on to the next slide. Roster law requirements, and I can see I'm multitasking, I'm looking at a few questions. I will get to all of them, but in terms of the roster lawyer, I know that many people have this curiosity. I'm already on the roster. What happens to me? Do I stay on the roster? Yes, you will stay on the roster. And for lack of a better terminology, I'm saying you will be grandmothered, but we need you to fill out the form. And you need to refresh your information. We need any updates in your bio that should be with us, should come to us, and we want you to do that form. And we're kindly asking everyone to do it. I can tell you that since yesterday when I sent it out, a couple of you checked with me, or a couple of other people checked with me. It's a very easy form to complete. It doesn't take a lot of time. So we are kindly asking everyone to do it. And here is the criteria, refreshed criteria. We want everyone obviously insured and practicing in Ontario for 3 to 5 years. It's kind of given. We want a demonstrated track record of trauma-informed legal practice and client-centered lawyering. We want a criminal record check and vulnerable sector check or an update. Again, if you need support with that, just tell us. We have system in place here at the clinic. We can get that done for you fairly quickly and seamlessly. We want people to have experience for working with survivors of sexual violence. We want that people accept that they will work on the hourly rate of $158. And we want people to have experiences in one of these following areas of law or multiple areas, but these areas are the ones that we really are looking for: criminal law, civil sexual assault law, sexual abuse law, ILA, representation of sexual assault victims in criminal proceeding, administrative and regulatory law, child protection law, employment law, sexual harassment, family law, immigration law, human rights law. Moving on to the next slide. Mandatory requirement to join roster are criminal record check and vulnerable sector check, completing of the application form, onboarding meeting that will happen with the project lawyer on making sure that we are getting everything right on our own list, completion of a substantive training after the launch of the program, commitment to complete refresher trainings to stay active on the roster, agreement to participate in evaluation of the ILA program, and signature of the rostering agreement that we will be sending out. Right now, while we are in the transition, we invited you to this pre-rollout so that there is no break in services for the client. So of course, all of you who are in this meeting are on the list now, while all of these formalities are coming in place and happening. But we need to make sure that the services continue, but all of these requirements will also be required to be fulfilled in next 30 days or so. Moving on. I think I already spoke to this. We want, sorry, can you please go back very quickly? I want to just check if I have missed anything. So we want to make sure that there is least amount of disruption. We want to make sure that the list is expanded to include all the things that Ashley found out and the gaps. We will be filling this list on a rolling basis. We are not necessarily going to say that we are closing it and anytime soon. So if you have colleagues, you have people you know who are great to work with racialized communities, indigenous communities, vulnerable populations, you know that there are lawyers who are sitting in somewhere in remote and rural communities who should be on this roster, and we should be connecting with them. We want you to help us in connecting us with those people. We have sent an open recruitment form, but we are also happy to send people invitations, and we will be happy to do that. You just need to let us know. And now we come to taking a pause, which is the next slide, and inviting questions. So let's first very quickly look at the questions in the chat already. Sonia is correct, is the answer that I am seeing to Sonia's question. So yeah, Sonia, as I said, I will confirm this back. We want everyone to be paying HST for our record, but we will get back to you and confirm this in an email. Ken, your question about will you be setting up direct deposit to make payment seamless? Yes, that would really help us. We will be asking you for your information when you send your invoice for the first time. It will only be asked once. And once you're in our system, it will actually make our life very easy to do direct deposit instead of cutting checks. So we will definitely would be asking for that. And anyone who is not comfortable, we are happy to cut checks. Will current rosters be rostered lawyers automatically be added? Jake, I've already answered that question. Juliana, in the rollout email, it is indicated following that additionally, we'll be refreshing the ILA roster to require new form. Does this mean? Yes, I have already answered that question as well. Can you use vouchers for 2 appointments each for 1 hour? That is my preferred way to meet with clients. Absolutely, you can, Karen. I don't think we would be putting a bar on that. We might want to then tweak the form, I'm thinking, to create an indication of that. So, but it's a good feedback. Thank you so much. We will make sure that that can happen. And then Jake has a response to advise Ashley offline around a lot of Crown attorneys are recommending the program to complainants mid-trial or just prior to trial when dealing with complex legal issues involving significant third-party records. The program does not cover the hours to review detailed records and transcripts. I think there needs to be clarification with certain groups. Absolutely. Jake, this is the kind of feedback we need because we will have an outreach designed along with the program. We have a project lawyer who will be coming on board, and we would need your support in making sure those misgivings or misinterpretation of the program can be clarified. I'll be coming to you, Jake, in 1 second. I just want to take on. Hi, Deepa. Okay, so I have an answer for you that the current invoicing allows lawyers to invoice the LAO hourly rate amount with no HST added on the top. So that's what the answer is. But so we will have to send you a communication about it. And I do appreciate that that means that the hourly rate is not then as much of an increase as it looks. But that's what it is for now. And then will the clinic be conducting the sector check as a registered agency on behalf of the lawyers, or will we be providing agency code to allow the check? So Jake, I'll actually look at Marian for this because she is the one who's in charge of getting that done, and she knows the most about it. I am sometimes when these kind of situations, I say, I'm just an executive director. How do I know? So I'm going to use that moment. Marian, over to you, and then I will come back to you, Jake, with your hand.
Sorry, Deepa, I was reading. Could you please repeat the question?
Yes, so the question is for vulnerable sector check. Would people be, how would it happen if people need to, like when they send their details to us, how can we assist them, or do we give them an agency code to get it done for us?
We have a process where we have it done online. It's a very, very quick process. It's often done within 24 hours. And I believe we have to, we need the ID, personal ID, and that's confirmed by, it's actually done through charity, what's it called? Charity Village. They have a online system. And if the ID is readable and there's no problem, it's very fast. If there is a problem, then we need to go online at the same time as the person who's applying and get it done in person.
So just to operationalize this piece, basically, as soon as your form is complete, someone on our end is going to take your form, put it in an Excel sheet, and follow up with you with pieces that they need from you to get this done. And then we will get it done for you. That's basically the operationalizing part. Jake, does that answer your question?
Yes, thank you. I just don't think it's easy to do it on your own, but that's what I was asking. Thanks very much.
You're most welcome. Anna, I often use the program to help complainants prep for criminal trial, as Crown almost never have enough time to help prep. Absolutely. I agree. And Joanna is saying exactly, I get the statement to the police and prep them. I know Karen B does this too. It's a great resource and an example of sometimes where an extra 2 hours can be helpful, especially with clients who are severely traumatized and disassociated. Thank you so much, Anna and Joanna. We are aware of it because, as you know, that the clinic refers clients to the voucher as well. So thank you for those comments. Jacob, back to you. You have your hand up.
Yeah, sorry, I didn't want to jump to different jobs. It's sort of the same thing what you're just discussing. I think the issue, just to be clear, is that Crowns are suggesting, as I think it was Joanna mentioned, that sort of that the voucher program be used to review sort of waiver issues when it comes to records. And sometimes, to be very blunt, 2 hours, 3, 4 hours is not even going to remotely cover it. Like some of these situations are coming to me with, hundreds of pages of text messages or whatever, and it's a bit of a gap, I think, between the program and what the court appointments, once the records applications are in place. There's an actual court appointment process for that. So it's just something to be looked at, whether that's an actual proper use of the program or the Crown should be notified of that. So I'm happy to give more information offline, but I just wanted to, alert everybody that.
And Jake, I want to say to everyone in the room, like all of those gaps that you have already known about the program, we'll be very happy to collect that information. We are obviously taking it on as a new program for us, but ministry has been running it. So probably this is a feedback that they have already received. And if there is anything that is possible at the operational level to bring improvements, we will. We are still restricted by what the criteria of the program is in its current format. But wherever there is a room for improvements from our end, we will bring it. And otherwise, we'll take it back to the ministry colleagues and happy to talk to them and figure out. We are hoping that there will be opportunities for gathering data on it, taking the feedback from you, taking the feedback from the clients, and making sure that we can actually bring some improvements. And thank you so much for giving us that feedback, because we need it. So is there any other question? If I'm not seeing someone's hand and I'm missing, please help me, whosoever sees. Any other questions for things that you have heard so far? I'm seeing that people are responding to each other, so I won't use that. Okay, so we have more time set aside towards the end, but we have some more slides to go through. Okay, so I think at this point, I invite Selena to talk about evaluation and gathering data, which I feel you all are already giving her ideas. Her brain must be right now, I know, moving really, really fast. Knowing Selena, she's like already thinking about, okay, these, what is the missing? So Selena, over to you.
Thanks so much, Deepa. And I know Viviana right now has figured out a way to solve whatever weird Zoom issue we're having with the PowerPoint. So there's 3 little dots there, Viviana. If you could see right under the screen, if you click on that, it should give you the option to hide the presenter view, and then I think the situation will be solved. But yeah, my brain is, I've been taking notes. I really, really appreciate everyone taking the time to kind of share what you're seeing in terms of gaps and how the program is working. I'm not going to talk for too long. I'm mainly just here to let you know that we are going to evaluate the program. And a lot of what we're hearing from you now and what Ashley talked about through the interviews and upcoming survey is really going to be our baseline data as we roll out this version of the program. So that's going to give us a really good baseline. And over time, we're going to be seeing, can we address some of these gaps with whatever is within our control and our role? Are there ways that we can enhance what we're currently able to offer? What's working well? What's going really well? Can we celebrate those accomplishments, document the impact, all of those kinds of things we will be doing. And I'll spend just a little bit of time talking about how we approach evaluation at the clinic. So you get a sense of just generally what that looks like. So if I could get you, Viviana, please, to turn to the next slide. Great. So just, plainly stated, our main purpose is to analyze and find ways to improve the ILA program through evidence-based approaches. So we use data collected from a variety of sources to really get a sense of what's happening, and then work with our stakeholders and our members and our survivors, clients, to really look for ways to enhance over time. Just that second bullet point there, I'll start there. What's our approach to working with survivors? Well, as Paula already mentioned, we're going to be checking in with them to find out what their experience is like. A lot of times the approach to evaluation is about like client satisfaction, which kind of uses a consumer model of like, is our customer satisfied? Well, the experience of our clients is important, but we try to do a lot more than that. So we want to know that they're having a good experience, they're feeling welcome, they're feeling heard, the experience is inclusive. But we also want to know what's the impact for them. So are they feeling like they have more knowledge about their legal options? Are they feeling empowered? Are they feeling more a sense of stability in their life over time? We have different measures to really understand what's the impact of the service for them. And then importantly, our clients are also knowledge holders. They are experts in their own lives. So we always want to engage them in terms of what are they seeing in the legal system? Where are they seeing gaps? What do they think needs to happen to improve? So we offer opportunities for our clients and survivors to participate in working groups and to engage with the clinic at other levels. So that's kind of happening in the background. It usually involves clients who are a few years out from service, who are in a more stable position where we come back to them and look for ways to engage them. So just so you know, that kind of is happening in the background at the clinic, and that will always inform any kind of evaluation that we're doing. We also want to hear from our lawyers, our stakeholders. You saw that with the engagements that we've done, the initial research. We want to know from you. Again, it's multiple levels. We want to know, is our roster list really meeting those diversity needs that we talked about? Is it growing? Is it a good representation? Is there a lot available? We want to know from you, what's the experience like for you? With the, with the connection with the clinic, with the voucher systems, your day-to-day experience of the program. Will be checking in with you about that. We also see you as observers, keen observers of trends that you're seeing, what gaps, what, and already there's so much that you've brought to the fore, like how are the vouchers being used and what are the needs of folks that you're seeing? Are there trends? Are there shifts that you're seeing over time? We want to know that from you. And broadly, we may check in with you every now and then for like that kind of research that we've already been doing with you, like what are some of the larger systemic issues? We're always interested and open to hearing about that. I'll just say briefly, we'll talk about in a moment the framework for evaluation. I'll just give you a very quick high-level overview of that. But I do want to assure you, just go back for a second there, Viviana, and that last bullet point there, that we are always thinking about the ethics of any kind of research that we're doing at the clinic. So thinking about things like informed consent, confidentiality, the safety of folks who are participating at that feedback moment, non-discrimination and respect. And we're happy to talk about any of those if you're ever have thoughts about that or want to know more about our ethical approach to doing research with community. Okay, so next slide. So just so you know, there is an evaluation framework. We have it on the clinic's website. I'm happy to include a link to that in a follow-up email. It's called the Trauma-Informed Evaluation, Learning and Leadership Framework, or the TEL framework, and that's our approach to evaluation. On that framework, you'll see on the next slide, we have some principles for how we do evaluation. We just want to turn to the next slide there. Thanks, Viviana. Great. So always, again, I'm not going to stay here too long. I just want to let you know that we're always recognizing that trauma is pervasive in society and that its effects are intersectional. And you'll hear a little bit more about that shortly. But basically, we always want to design for that. We always want to consider how trauma might be experienced by different populations in our society, including equity-seeking groups who may be experiencing trauma at the individual level in terms of their experiences of violence, but also maybe experiencing systemic trauma from interaction with the systems and so on, societal level, family level. We're trying to think about it at multiple levels and designing for that. And the idea here, principle number 2, we're motivated. It's not just about recognizing trauma. We want to try to transform the systems that are causing trauma in people's lives as much as we can. And that means that any kind of evaluation that we're doing also needs to do that. We need to be thinking about, are we ensuring that we're not re-victimizing people through the methods that we're using, the questions that we're asking, not giving them the information about their confidentiality, not creating a space of safety when we're doing evaluation. So we're always thinking about that, even at the level of evaluation. Number 3, we center people with lived experience of trauma in our evaluation design and implementation. And that could be simple things like, having an online form might work for some clients. It might not be the best way to collect feedback for others. There may be language barriers. It may be activating for them to have another bureaucratic form that they need to fill out. They may not have a safe space to fill out an online form. So we want to have other modalities that we're using. And in this program, it's going to be the intake worker who they already have a relationship with. There's an option of that person checking in with them that we've incorporated there. And there will always be an online form available for those who that modality works for them. So to try to have multiple ways to participate. And then number 4 and number 5, so we're empowering people with lived experience of trauma in leading or meaningfully informing evaluation policies, tools, and practices. That speaks to what I was talking about earlier. We have community engagement working groups. We run our evaluation approaches through with clients. They see what we're doing. They inform it as community members. And we emphasize transformative learning and collaboration over scarcity and competition. I could talk for 20 minutes about that. What I'll just say here is that our intention here is that all of us are learning. All of us, no one is expected to be perfect in doing this work. And the idea is that we always approach it as, okay, what are the challenges we're experiencing? How can we learn? How can we do better? Rather than it being something where we are, where folks might feel a little bit more judged or where there's like a competition between, oh, your service is better than my service or whatever, that can sometimes fall into that trap. So it's very much about being collectively learning together. And I think that's it for me. If folks have questions, I think we'll have another opportunity after the next set of slides to check in about any evaluation questions that you have. And I think I will hand it back to my colleagues to talk about some fundamentals of trauma-informed practice.
Thank you so much, Celine. And I'm seeing chat happening in the chat box, and I'm really, really excited to see it. And this is exactly the reason why we want a discussion board and a community practice space for all of us, because these conversations are important. We will be learning a lot from all of you. Our brains will be expanding from your expertise in coming weeks and months. Let's change gears and talk about trauma-informed practice. And what we are going to share with you is the practical approach that the clinic believes in and is part of the clinic's DNA and ethos. Clinic takes a lot of pride in being a trauma-informed space, not only with our clients, we also take pride in the fact that we are a trauma-informed organization and we are trauma-informed with each other. We are also deeply rooted in our anti-racism and anti-oppression practice. We have been committed to the fact that the world that we work in with a lot of systemic changes is not necessarily trauma-informed, but we are committed to it and we will remain that space. What is the learning outcome for next few slides? If we look at that from the next slide, and I'll be joined by Tamar in this conversation. We will be looking at addressing the current ideas in the field of trauma, critical to trauma-informed approach. We will try to speak to the constellation of the responses that might manifest when a survivor is experiencing abuse and violence. We will learn how to apply trauma-informed lens in your practice and interviewing and investigations. And then we will share ideas on understanding vicarious trauma and learn ways to mitigate it. Towards the end, we will have space for reflections and we will open floor for questions. So we will try not to speak too much because we do recognize a lot of you probably have taken many of these trainings, but this is the Schleiferized version of it. Tamar, over to you.
Hi, everyone. Nice to see you all. Just to give you a framework as well, in addition to the ILA work that we do at the clinic, you probably know that in our department, the legal department, we also work with clients who in family law issues and in immigration law issues. And so, the way that we participate in this ongoing work of trauma-informed practice is also informed by those various perspectives. In terms of the basic framework, as you can see on the slide, trauma-informed practice is an increasing, sorry, is an increasingly prevalent approach in the delivery of therapeutic services, social and human services, and that has been adapted, as you know, into now the legal practice. So simply put, the hallmarks of trauma-informed practice are when the practitioner puts the realities of the client's trauma experiences at the forefront in engaging with clients and adjusts the practice approach informed by individual clients' trauma experience. Trauma-informed practice also encompasses the practitioner employing modes of self-care, that understanding of potentials for vicarious trauma to counterbalance the effect that the client's trauma experience may have on the practitioner.
Thank you. So trauma-informed approach, what are some of the fundamentals that we understand? We want it to be collaborative, and Tamar just gave you example of the family law, immigration and refugee law practice. We also have a project dedicated to the criminalization of survivors. We have 3 staff members who work on that project. We have 2 lawyers and a coordinator who provides case management. We also have now going to have 2 lawyers on sexual harassment and precarious workplace. So in our approach of work, the clients are not necessarily going through one single story experience, and they need a collaborative approach of work, getting support from various points of entry. We have also been designing a collaborative counseling program to support this new program that we are taking on for the voucher system. So you will have a space to refer your clients back to get counseling, specialized counseling, which will be culturally competent, not only counseling, but all our services, which will be anti-oppressive. We will make sure that from our end, and we expect that from your that you understand that how trauma changes brain. We want to make sure that clients are contextualized, not pathologized. In clinics, and this is a cultural thing that I want to convey to all of you. In clinics work with you and your work with clinic, I would want you to kind of understand that we won't use words like this client is having, and I'm sorry I have to say it this way, that this client is acting crazy. That's not what we would say ever. We would rather say the client is having trauma experience, or client is having mental health along with other challenges. So I want you to take a note of it, because when someone writes those notes to you, I want you to make sure that you're understanding that that's the way we talk, and we contextualize the experience. We make sure that there are we understand and regard the coping strategies and adaptations of the individuals, and we don't look at those coping strategies as deficits ever. We use a harm reduction approach in every setting, including substance abuse, and we understand vicarious trauma and the ways to mitigate it. Back to Tamar. We're making sure that you don't get bored. This is the reason why we are doing this.
So, of course, we all understand that it's important to be trauma-informed, not only in the general sense, but at every stage of client interaction. So as we've already explained, at our own intake and assessment, we are talking to the client, we are assessing their needs, and then when we provide some background to you, you then continue on in terms of providing that trauma-informed lens when you continue to do your intake and then determine the advice. The pace at which you can provide the advice, the amount that the client needs, the stages of where they are in not only in their legal process, but in their own personal process of dealing with the content of their experience. Obviously, in terms of representation as well, a lot of our trauma-informed work has to take the form of advocating for the client, working with other support providers and other legal players. And then, as you know, many of us are engaged in law reform work and systemic advocacy, which is a way of taking that understanding of trauma and trying to look at systemic issues to mitigate the impact on everybody. Trauma exposure, of course, is so common that the effects are so profound. It calls for a universal stance grounded in do no harm, as Deepa said, both at the individual level and the systemic level.
moving along, Viviana, if you can help us. Thank you, Viviana. So we do take people's experiences of collective trauma really seriously in our assessments because we know that individuals and communities can be deeply affected by their systemic experiences and events. That could be a war, it could be genocide, it could be racism, heterosexism, forced migration, high rates of incarceration, and colonialism. One thing that I hope that all of you would really, really enjoy when you work with our assessment team and intake team is that you will see that there is an expertise and there is grounding of understanding those collective trauma experiences and verbalizing it in the notes that you will receive from us. We will summarize that for you and you will understand why we are talking about these things at this moment, because you will get that background in our assessments. These collective trauma experiences can sometimes be intergenerational. They can have effects with or without additional personal experiences of abuse and violence. And again, clinic's approach is sensitive to that, and it is reflected in the work that we do with the communities. Back to Tamar.
And I think just to add to that, and what we hope will be a sort of a value that the clinic brings to this larger ILA program, because what already exists in our, the ILA programs, the ILA services that we provide and the interactions with lawyers on the MAG list or other partners, it is also possible in the work that you do with the clients that more things will surface that may not have actually come up in that original intake. And so when you do identify areas where the client can be better supported, either in another area of law, as I said, like family or immigration, or in terms of counseling, or in other kinds of referrals to the community, the opportunity is then to get back in touch with us, and obviously with client's consent, and then we can continue to pick up the ball and work with the client in those other areas to provide that, what we have often termed as a kind of a wraparound approach to service. I think we're on the next slide now. So this is, this is our basic understanding in terms of the actual, the functioning of the brain and how it is impacted by and can often respond to the experience of trauma. And I'm sure that you've experienced these kinds of things in working with clients already. So in some cases, the client displays what is, termed hyperarousal, and it's a kind of behavior where they're agitated, they're unable to focus, they may not be able to calm down, they may not be able to actually coherently or logically describe what their experience was or what they want. And in those moments, there are many strategies. I'm sure you have tried many yourself, but the goal obviously is to try to take a step back and to provide some of those soft skills in order to help the individual calm, to focus, perhaps, asking them even literally to just, sort of put both feet on the ground, to take some breaths, offer to, give them some water, and possibly even having to interrupt the meeting in order to reschedule and give them an opportunity to just, come back into that sort of that area in the middle, the so-called window of tolerance, when all of us are, for, in our lives and based on whatever experiences we've had, are more or less able to actually focus on the task at hand. Other impacts of trauma can present in a kind of a flat affect, what's termed as hypoarousal on this slide, where clients are not responsive, are not able to articulate. They might actually be overcome by emotion. And clearly that too makes it difficult in the moment to work with a particular client. And the goal again is to try to bring them back to a more collected and state of calm through those strategies of slowing down the pace, reviewing what has been discussed, setting an agenda for what, can be, dealt with in that particular meeting. And obviously, I think in the context of our understanding, the time that you spend with clients and like, the 4 hours we've already indicated, for some clients, there will be some ability to be flexible to be able to work with clients in these very extreme situations of dealing with their trauma.
So this is where we talk about the trauma that changes our brain. And we all know from the literature and the science of how brain works that we actually engage with their neocortex for almost every activity. Like I'm talking to you right now, and I'm engaging my neocortex. Our brain is usually divided in 2 parts, and one of the parts which is the right hemisphere of the brain, is something that is developed at birth. And we see our holistic big picture and the ways of being creative and artistic. And then we have the other side of our brain, which is the rational left hemisphere, which is underdeveloped at birth. And we see the world in an increasingly rational way as we mature over time. Now, the practical reality is that our trauma and the stress impacts this capacity. And when Tamar was talking about that window of tolerance, we all have that window of tolerance. I call it my happy place. And that happy place shifts for all of us. And there is nothing necessarily wrong with the shifting of the happy place. The challenge is when our happy place shifts, we are not necessarily engaged in the conversation in the same way as we would when we are fearless, at ease, basically managing our emotions at a very calm pace. Most of the time, in my experience of teaching lawyers or students who are becoming lawyers or training or working with my people in my counseling team who are way more advanced in their learning for this area of work, what I have understood is that a lot of times working with clients, it's not necessarily where your client is at. It is where you are at, what is also really, really important. So in whatever the client is going through is something that you will have to help them manage. But what is going on with you and how you are responding to whatever the client is bringing forward is something that you need to learn how to control. You need to control how you are responding to a fear, how you are responding to someone trying to protect themselves in sense of trying to be combative with you maybe, or be quickly try to stay alive, and make sure that they are necessarily, when in that kind of situation, you are self-aware and become more stable and skilled to deal with that emotional challenge and intellectual onslaught of questioning that you are probably thinking, I want time with you. I need to build trust with you. So neocortex renders temporarily less active when time is of essence. And that's when we start making even more mistakes. And what we want to share with you is that what happens to the client is something that you need to understand, because you need to understand how the brain works and how the communication and the coordination and consolidation of information is happening for that people. But more importantly, what we really want to convey to you from our approach is that we need you to understand how you are responding and how you are analyzing and developing insights and theories into this experience with the client who's activated and is not in that happy place, as Tamar was explaining. It is either hyper aroused or hyper aroused, because they necessarily don't know what is going on with them. Now, with this new knowledge, or knowledge that you already have and you're experts on, I think what can happen, at least that's what we practice here at the clinic, we try to give this education to the clients And it has a very calming effect on them when you actually tell them that this is what is happening to you. And if they are already coming to you with some of that education, our hope is that by the time they're coming to you and you are engaging with them, you will be able to help them with this using of this top-down control mechanism so that you can actually help them go through your appointment. Sometimes when people ask me, what is this bottom-up response that you're talking about? There is so much theory here. I always tell people, think about that night before the exam. Think about that time when you are fatigued and you are really, really tired, but you have an exam to write next morning and you actually excel in that exam. In spite of the fact that your body's tired, you're exhausted, there is also a lot of challenge in front of you, but because your left brain rationally takes over the control of the situation, you know that you have an exam to write, you write it, and you excel. But that exhaustion still is not to be discounted, and we cannot necessarily tell ourselves that let's not think about it. What that exhaustion that is happening for your client is really, really real. For them, when they're meeting with you, they're probably writing an exam. So that's hopefully will help you think about what is happening to them and what level of psychoeducation do you need to share with them when you're going through that appointment. We will do our bit for you and make sure that they come ready with that information, but we also want you to understand that piece of their experience. Tamar, back to you. This was heavy. I'm sorry.
Oh, and now we move on to the emotional parts. The long-lasting responses to trauma result not simply from the experience of fear and helplessness, but from how our bodies interpret those experiences. And so I think the point here is that in addition to those immediate responses that we're aware of in the moment, when someone's experiencing trauma, they might freeze, they might try to flee, they might try to fight, they may feel fear, faint, or over aroused. There is also the sort of the lasting imprint of that immediate experience that obviously we know, I think in terms of the phrase re-traumatization, the body has remembered that response to that crisis moment. And a variety of triggers can return those emotional responses to the fore. And so obviously, we do our best in providing services to clients to not re-trigger those experiences. And sometimes it is, quite frankly, unavoidable. But it's important to know and to gauge and again, to watch for those markers of a client's response that indicates that they are starting to relive or feel uncomfortable, leave that zone of tolerance as a result of the work that we're doing with them. And then with that, awareness, with that understanding, just again, bring to bear all of those skills that, we've all been developing over the course of our practice to calm, to build trust, to redirect, to give breaks, to, allow for pacing, and perhaps even most importantly, to explain our process to the clients so that they understand why we're asking the questions and why we're moving in directions that could be unsettling or destabilizing for them.
Thank you, Tamar. So moving along, why do we need to understand trauma and why that is just a first step? The power structure of medical model within which people practice, we all practice. The treater is an authority who has something the client needs. Client is a sufferer and needs in need of a service or an expertise of a professional. This recreates the situation of dependence associated with the danger, pain, and betrayal for survivors of child abuse. So this is a study, obviously, which is focused on that experience, but you can replace the medical model and think about legal system and the inherent power imbalance a client has with a lawyer. And you could say that experience of survivors, experience of abuse and dependence relationship and its effects can actually be recreated in that experience as well. Therefore, and I always say this in my trainings and in my talks to people, I could, basically have a large banner outside our building saying, we are on your side and we are one of you for survivors, but for survivors, we are system. That's just the basic reality of who we are. For them, we are not on their side unless and until they actually build the trust with us, unless and until they get to work with us and understand who we are, and that takes time. So from the perspective of the work you will do, we will start that journey for them here. We will start that process of them trusting us here, but understanding their trauma and understanding that there is an inherent power imbalance in this relationship, which means there is an inherent lack of trust that comes with the structure of these relationships is actually existing. And agreeing to that is the part of also being super self-reflective the clinic is. The clinic has a commitment in our values to be reflective in our practice. And we try to do that on a daily basis when we work with clients here. And we are sharing this with you because we want you to come on board with our Schleiferized version of the trauma-informed practice. Over to you, Tamar.
Yeah, so how might we unwittingly re-traumatize? I think, picking up on the point about this, inherent power imbalance between holders of knowledge and our clients who really seek that knowledge, are desperate for it. And then all of the other social overlays, right? I mean, in terms of the elitism in our in our society in which lawyers are held, and then remembering again, again, it goes without saying, we all know that in terms of like anti-oppressive practice and understanding cultural differences, the ways in which many of our clients may view us as allied with, authority figures, social location, wealth, race, religion, all of those things may be part of the way in which we were originally perceived. And so, we don't want to unwittingly reinforce those kinds of distances and barriers. So, I mean, obviously, we do have to talk about the trauma, but gauging the response that we're getting from the client, again, contextualizing, and obviously, focusing on what's relevant in the moment. Also, I think choice of language. I'll give you like one really like simple, but I found it like an instructive example. One of our family court support workers who was working with a client in a family law context was debriefing about that client's interaction with their lawyer. And, the lawyer quite rightly was trying to focus the client on the information that was going to be most relevant to the legal issue. And when the client was speaking, the lawyer said, that's not important. We need to focus on something else. And the way that the client heard that was that their experience, their story, and the need to actually say it was not important. And that in that particular moment was something that was actually quite upsetting for the client. And so even in our most, sort of heartfelt and dedicated efforts, we just, I think, always need to be aware of how we might be perceived. And again, I think, now we're starting to repeat things. People who are unwilling to provide some information are not being, it's not that they're deliberately not compliant, but they haven't reached that trust yet. And just being aware that all of the whole experience of the client, coming to meet with you, other people that they engage with, all of it is new and potentially intimidating. And so those are the things that we try to focus on in terms of reducing the potential for re-trauma.
So moving along to some of the practical approaches, we know that trauma-informed practice requires spacing. It requires time to build trust and relationship. And I do appreciate that as voucher lawyers, you might not have a lot of time, and therefore this continuum of service that we are hoping that we would create would help with some of that relationship building. Obviously, avoiding confrontational approaches, providing choice and control. I always, in my trainings, kind of give a very simple example. The choice and control starts with your first interaction, which is around, I can meet at these 3 times, or if someone enters your room, you can sit on any of the chairs available. So choice and control can sometimes be big things, but it can also be simple, few things that you can do for them to feel that their agency is being given back to them where it belongs, instead of us controlling this conversation. Again, collaboration with us, collaboration with various programs and projects here at the clinic. Over the course of time, we will send you videos to watch. We will send you more information about our projects and programming. We do understand that for some of you, you very well understand all our programs because you have worked with us closely, but for others, not so much. But there is a huge value added advantage of working with our various projects and programs, and we will make sure that you get those resources. And we will pace those resources. We will not overwhelm you. We will pace them to a point of how you want to receive them as well. You will be added to a SharePoint site where you will have access to these resources, and you can do this learning at your pace. Obviously, working with focus and strength and skills, organizing time, watching your client's capacity, explaining the purpose of the questions and the approaches, front-loading as much as possible. Front-loading is the key in building a good relationship, where you tell them at the beginning of the interview, every interview, doesn't matter how many times you meet with them, who you are, what your role is, how you're different than the clinic, and what is that you can do for them. In terms of this approaches, we want to make sure that you meet the clients where they are at. You work with the stages of changes with them. You talk about their goals, and their goals should be consistent with their current abilities. Motivational interviewing, which focuses on people's learnings from their setbacks, avoiding shaming and blaming, building on their strength, and providing range of options. Relationship building, obviously, and the quality of relationship is something that is probably a lot more important. And the concrete supports can take time to build. But I think a relationship which is based in transparency and honesty is the key for a good trauma-informed practice framework. Back to you, Tamar.
I'm not 100% sure the purpose of this slide. I think, you know, I think the point really is when we're working with our clients, there are obviously, you know, procedural steps that we're helping them to work through. There are some substantive outcomes which, you know, we're helping them to achieve. And at the end of the day, at least in our practice, sometimes the best outcome is not really something that is what's available, or you know, what they're hoping for is either not realistic or it just doesn't work out that way. And I think also being prepared to work with clients to understand the limitations of the legal system, and to, you know, to be transparent and clear, and to work with clients in an honest way, you know, in terms of what managing expectations.
Absolutely. And if I may add, I think this slide kind of speaks to the ethos of understanding that why do you need a holistic services for a client? Because your client is not necessarily, because as lawyers, we are only thinking about procedural and substantive justice stuff. But for her journey and her healing, that might be sitting outside this paradigm. And therefore, we are inviting you to connect back with us and get the continuum of services from the clinic, because her ultimate goal might be to complete that school education that she is pursuing. Her ultimate goal might be to get housing that she needs. So her healing is not necessarily connected to access to justice alone. And it's, as lawyers, sometimes we are given blinkers and we only think about procedural and substantive justice, but people's experiences and journeys are outside that, and giving ourselves permission, giving ourselves compassion to understand that we are only one of the tools in the toolbox for clients. We are not necessarily an ultimate holder of all the responsibility for her healing, and her journey is really, really the key. And the relationship back to the clinic is really important. Moving on very quickly, I think we are just recapping in the next slide things that we have kind of already spoken about. We have talked about the ways of interviewing and giving people choices and minimal re-traumatization. We have talked about hyper-aroused and hypo-aroused clients. We have talked about ways to keep clients focused or refocus. And where needed, avoid talking about her traumatic experiences, because we will be giving you summary, because we will be providing you with some background information. One of the key easy ways that we try to practice is to confirm the information on the form instead of starting the process all over again. Because when you're confirming that information, there is an automatic building of trust, because now this person knows that you already have a level of information that was previously shared, and you're confirming. So the role modeling of this would be, Tamar, is your name Tamar Vittilson? Yes. Is your date of birth so-and-so? Do you live at this address? Yes. And I read from your form that XYZ happened on this and this day. Is that accurate? And that at that time, Tamar might say, no, 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 no. This information is inaccurate. Actually, I have moved since then. There might be other things that will come, but at least when you are sharing that information as confirming it instead of asking brand new information, your relationship building will happen much faster. Methods to help a client remember details and to prepare testify. I think we didn't talk too much in these slides today about it, but some of the stuff that we talked about, trying to practice things that reduce re-traumatization, or things that we talked about around building relationship over time and the stages of the change that the client needs to go through can help with that. I'm taking a mental note that probably this is a piece that we need to go deeper into our next round of trainings. One piece that comes up a lot in our trainings is that I booked an appointment, I'm a busy professional, people didn't show up, or they showed up late, or they missed appointments. We will do everything on our end to do that education for the clients when we are doing the referral. But I also give this example, and humor me with my cultural joke in this moment. I am, as you all could guess, I'm from India originally, and in India we have something called IST, which is Indian Standard Time. The Indian Standard Time is 1.5 hours after the clock. So right now, for me, it is 12 past, not necessarily 11:44 in Indian Standard Time. So understanding that cultural nuance sometimes can help you think through about people's, coming late and missing appointments, that it's not necessarily that they are doing it on purpose. They are just sometimes trained. And I'm not saying it's a good practice. I am definitely unlearned, and I was here on time. I was actually here very early this morning, prepping for making sure that I was ready. But that is the cultural nuance that I want all of us to kind of be aware of. And again, we will do our best to make sure that happens less and less for you. But when it happens, be trauma-informed, be aware that this is not necessarily coming to meet you to talk about their sexual assault is not their happy place. They are not really excited and looking forward to it. She didn't get up that morning to say, today I'm going to talk about my sexual assault with Tamar or Anna, right? She is probably dreading this meeting, and then she is probably coming a bit late for this appointment. And again, we talked about techniques for building trust with clients. So this is a recap. Moving on, we are coming very close to the end of this deck. Tamar, back to you.
So just to read the text on the slide, the cumulative experience of working with traumatized people leads to what is known as vicarious trauma. I'm sure you've all heard the term. Lawyers working with clients who are sexually assaulted or abused or who are fighting human rights violations can be vicariously traumatized by this exposure. Compassionate lawyers may be particularly vulnerable to this secondary trauma because they are likely to respond to these clients with underlying understanding and underlying empathy. So coping strategies are needed to go beyond simple stress management. Lawyers need the ability to identify, manage, and contain their own distressing emotions. What we really internalize here at the clinic, and you know, I recognize that we're quite privileged in having a sort of a group of colleagues with whom we work on a daily basis, so that there are ongoing opportunities to recognize when we are having a response to the stories that we're hearing, the clients that we're working with. And so some of the strategies that we use are being able to just debrief immediately or over time about just retelling that story about what the client has told us or what it is that we're trying to do to get others' perspectives on maybe approaches that we haven't thought about in terms of reducing like the client's distress. I mean, we really prioritize trying to, I think, set barriers for the demands that clients put on us, reasonable barriers, but also encouraging like our own discipline in terms of ending the day at a certain time of day and taking the time off that we need, and looking for moments to celebrate the times when we've actually had like even a very small positive outcome, a win, something even as simple as feedback from a client that, that even in the midst of an ongoing issue where there isn't a resolution, where they have felt heard, where they say, thank you for listening, thank you for understanding, thank you for working with me, thank you for talking to the Crown, and I feel much calmer or better. Celebrate those little moments and fill yourself up with the importance and the great work that you are doing, and that it's having an impact on clients in many and various big and small ways. And just pay attention to the fact that this work can be hard, it can actually have an impact on us, and because we are compassionate people, even more so.
So moving along, because I think we just want to get to, yes. So this is the piece that Tamar was talking about, that resistance to trauma, like how do you do it? Because I know that many times vicarious trauma is seen as this doom and gloom, but I always say that number one, it is not doom and gloom, because there is something called post-traumatic growth that can actually give you freedom of another kind. But at the same time, there is a few things that, as Tamar was already sharing, that we can do on a daily basis to create the resistance to vicarious trauma, which includes creating healthy boundaries, professional ethics, celebrating the success, even small or big one. We want to celebrate those big and small successes with you. And that's why we want that discussion group started, where we can actually hear from you and learn from you, how you were able to support and share with you how the outcome was really well captured in Selena's work, right? This whole team is very intentionally and thoughtfully put together, because not only will it actually do the business of actually operationalizing this project from the clinic, but it will also help with some of the mitigation stuff that needs to happen, because we will share those good stories with you. We will not share traumatic stories unnecessarily. We will not share too many details unnecessarily where not needed. Of course, on that referral form, you will get that, but not oversharing where it's not needed. Even in the discussion board, that is something that you will see that, when we put that structure in place, we will be asking you to maintain a bit of a protocol around that piece. Disconnect with your email when not working. I think we all should do that. It's a really good practice. At the clinic, we have a policy in place that you cannot check your emails after a certain time. If I asked right now people how many people actually really follow the policy to the T, I think many of us are culprits, but we try, we encourage, and we make a commitment to each other. We look into each other's eyes and remind each other of those policies. Use your allocated vacation and sick days and keep us informed. If you're going on a long vacation, please do so, number one. We will celebrate that for you, but also keep us posted when that is happening. That would be really important for Paula and her team. Even if you are wanting to take a mini break from being on the panel, right? Like you're like, for 3 months, I don't anticipate that I will take any clients. Just keep us posted. We will really, really appreciate it. It will help us with our work. And then organization-wide trauma trainings. If your firms need this kind of a training, we have a curriculum that we can put together for half a day training, for 3 hours, for 2 hours. We are happy to come and be your support in your spaces. We have some great curriculum developed. The clinic is a teaching clinic. I think we didn't talk too much about it. We run multiple courses here and have partnership with 3 different law schools. So we have a very deep understanding of how to do education and training around these pieces. So happy to come and support you with that work. And now is the time for you to speak. We spoke for a very long time. We want to hear from you what your reflections are. What did you hear that resonated, or something that you felt, I knew this already. I mean, I know many of you already knew all this, but anything that resonated for you, or anything that you feel like is missing? I think I already told you about a mental note that I took of something that I feel is missing. Any thoughts?
I was
Deepa, there's some
looking
comments
for
in the chat.
I was looking for the hand up, but I cannot find it, so I hope it's okay if I speak. I feel like this is such an amazing day for people working in this area of law. You know, when this started in 2016, I believe, and you know, shortcomings to the program, but look now, like this is wonderful for our clients, for them to have such a comprehensive process, and even for us to be able to share our experiences. I think it's just going to be better overall for justice, for the clients. So thank you everyone who was involved in making this happen.
Thank you, Cornelia. Just full disclosure, I know Cornelia for a very, very long time. We used to organize as activist lawyers back in the day. So really happy to be working with you in this new avatar, Cornelia.
Yes, it's very exciting.
Any other comments? Sorry, go ahead.
Sorry, Deepa, I just saw a comment on the chat that maybe I can just quickly address. So I think it was Juliana said, also it would be helpful if it would take less than 5 business days to schedule an interpreter. So normally we can get an interpreter within like 3 days, sometimes, you know, earlier. However, depending on the language, there are some languages that we have limited amount of interpreters. And that might not be possible, but normally we can do that before the 5 days. Just wanted to let you know that.
And Juliana, here's another piece that I think you should know. We will probably book another rotation of like a meeting like this with our interpretation team for all of you, because what can also happen for your own practice, you could become our interpretation client, where you will be able to get interpretation in less than a minute, actually, for a quick conversation with a client. We have a service available like that where you can connect with interpretation. We want these this online interpretation access really short because it's a very expensive service. So we don't want to use it for long advice session, but for a quick conversation, we can actually get you an interpreter in less than a minute. But you have to be a registered client for us. When I'm using client, I'm using as a client in the interpretation, because you have to be a booked agency or a client for us. We have a lot of amazing programming there. We also run that as a social purpose enterprise, and we will love to tell all of you more about it, because for your survivors of sexual assault, survivors of human trafficking, and domestic violence, these services are free. But if you have clients who are beyond those services, I think you should still look into hiring us for your interpretation needs. We are one of the best services in town. Do you see how quickly I changed my gears? And it is a social purpose enterprise. A lot of our interpreters are themselves with lived experience and survivors. So you should also hire us, and we will arrange for a different session for you all to get better sense of that. But yes, when we are referring, as Paula said, we will get you an interpreter booked at the same time. Anyone else with any other comments? Or
Karen has a comment in the chat there, Deepa.
okay, let me read it. Can you please explain how to choose 3 lawyers to provide a client rather than allow the client to choose their own lawyer from the list? That appears to be a new process. So Karen, we are trying to basically give 3 lawyers based on the needs that are arising for the client. So it is the needs could be geographic, because the client, if the client is somewhere in a rural northern community, it is best to connect them somewhere there. Language could be another thing that, if the client is sharing a preference that they want to work with a specific language, and a lawyer is comfortable in working with that community or that particular language, and area of law of expertise. So those will be the 3 criteria based on which we will be giving them names from the roster. And that would help them to get to the lawyers quickly, and for lawyers also to kind of have a sense, because we will be maintaining the stats on this and data on this. We can present to you, what are the trends that were coming for us, and so on and so forth. It will just be overall an improvement that we experience. Joanna is saying it is not necessarily the case that a local lawyer is better. You might want to give them the roster as well as the 3 names. We haven't thought about giving them the roster at this point, Joanna, but definitely thank you for the feedback. We will definitely consider it. The roster is not going to be a short roster that it was. It will be very long, and because of this open call, we are thinking that it will be, and we don't want our clients to be overwhelmed. But we will take your advice. It is a council of choice issue, especially if we all operate remotely. Absolutely, we get that, but we also would want to make sure that we remain client-centric in our referral process. This is the process that we adapt currently in all our referrals. So that's something that we would like to continue with, but we take your advice and your counsel on this seriously, and we will see how things get operationalized. But giving a very long list of an overwhelming list of counsel is also not going to be the solution.
And if I can add something to that, Deepa, actually we developed this process based on the client's feedback, especially like when they get these long lists from legal aid, they always came back to us and said, this is huge. I have no clue which of these lawyers to pick. And so that's what helped, that feedback helps us develop the process that we have right now.
Yeah.
I just wanted to add that.
But we are hearing you. I just want to say that, in the ethos of the clinic, we don't dismiss any voices. We are hearing you. We are understanding what you're saying. And we will definitely take it. And we will hear from the clients directly as well. And we'll bring back the information to you. Not everyone is available to accommodate the client, especially in short order. More than 3 names would be helpful. Juliana, thank you. All I want to say is we will, as anything, as any new thing, you have to pilot it, and then you have to look at the outcome of it, and then you have to fix things. So we will do that. And as you know, that we also still continue to provide ILA here at the clinic. For a client who needs someone fairly quickly, that option will always still remain. So So we will most definitely keep your advice in mind. Any other reflections or any other comments? Anyone? Do I understand that you will also give them a short bio or maybe a website link things? Yes, absolutely. That's what is the understanding, Megan, that we will give, it won't be just giving a name in blank. It will be a name with people's credentials and what has been, that's why we are asking everyone to do the form, because we need that most updated information about people. Absolutely. It won't be that we are giving them cold, it is not cold referral system anymore, is what I want all of you to understand. In the clinic's language, we say, something called warm referral system, which means that the person is having a lot more awareness and choice in the process. But I also take everyone's feedback, very genuinely to heart, that if people feel like giving 3 names is very restricting, we will revisit it, but it has been developed over the years with a lot of thoughtfulness in mind. So we will keep you posted if there is any change. See, the good thing about being collaborative is that there is more room for shift and change. There are certain things which are structural, which we won't be able to shift, like the hourly rate. But other things are there. We can have a lot more nimbleness in the process. Is there any other comments or questions or curiosities? Do you have a specialized experience working in following areas of the following communities? Need some clarity. Okay. Jake, if you want to send the email back to the communication email address, or you want to put that in your form that I'm not able to answer this question or something like that, we will loop back with you.
Sure, I'm happy to write an email. I'll just give you an example, just very quickly for 2 seconds, where it says, for example, you have on one line immigration or refugee law, or working with immigrant, refugee, and non-status communities. Like, I'm not an immigration lawyer, but I have experience working with those communities, obviously through my practice. So, you have it on sort of one line. There's a few examples like that where I think you need to break it out more between areas of practice versus communities that we've practiced with, right? That should be a separate I think it would be a little more helpful for it to be a separate sort of question, or 2A or 2B or whatever, right?
Okay, awesome. Great feedback. Ashley and Viviana can get that done even before the weekend, hopefully. So we will definitely look into it. Thank you so much. Is there an option to allow for under 16-year-olds or the parents? There is a need there? Thank you, Karen. We have heard a lot about it from our hospital colleagues as well. It will be one of the pieces that we are going to wrestle with ourselves. So thank you for raising that. Okay, so very quickly, I know that we are losing people. We are 3 minutes ahead. We had promised that we will wrap up by noon. So very quickly, recapping, April 1st, 2025, the clinic will start running the program here. It will be launched here. We are taking application on a rolling basis. It was launched on March 27th. Please, please, please get all your colleagues who have all this time complained. Where is this roster and how do I get on it? Please ask them to fill out the form. We really need people who are committed to this area of law. We will be setting up mandatory trainings for the roster lawyers in coming months. The exact dates will be decided. You will be kept posted. And we will be leading a broader community consultation via survey in spring, which will also happen soon. And we will be looking at you to help us get that advice from the communities. So thank you so much. Thank you for joining us. I have to say, my heart is so full right now to see all of you, to have this opportunity to connect, talk to all of you, hear from all of you. We are really looking forward to working with each one of you and be you part of our community. Clinic has a fundraiser on Sunday called She Matters. 1 to 3. There is information available on our website. If you haven't bought your tickets, let us know. Be part of our community. Please come to our events, book meetings with us. You want to come and visit the clinic, tell us. We will book a tour for you. All of us are really, really looking forward to working with all of you. Thank you so much.
Thank you.
Thanks, everyone. Bye-bye.
Thank you.
you.